I've had the great privilege and honor of being a chief executive in the National Health Service in the UK and now here in the United States. And I think we have so many things that unite us on each side of the pond. And so as we endeavour to make these amazing changes in terms of delivering services through digital platforms or in different locations or through different types of clinician, or indeed raising the voice of patients as caregivers and supporters themselves, that will all be based on trust. Any great endeavour is based on trust. Our future is really predicated on a collection of people with good hearts, good minds, and different perspectives coming together.
I think the biggest challenge is breaking outside the day-to-day and looking at how we can improve, and especially in the area of electronic health records. We implemented Epic about a year ago, and it's been very challenging. I like to say it's the biggest improvement project that we've ever taken on, and it's just now feeling like we can come up for air. IHI was a tremendous experience. I think the most important thing I learned, and one of the most important things I bring to Mass General, because Mass General attracts the best and the brightest from around the world. It has a worldwide reputation, which it very much deserves. It's an amazing organization. But I learned at IHI to look outside of ourselves, our organization, look what someone else is doing. And while we may not want to copy it, we certainly can learn from it. So I think my biggest learnings at IHI were about listening and looking.
So as a chief medical officer, I think that the values and behaviors that lead to the best patient outcomes are, I think of it as being twofold. On the one part of it, there are the values and behaviors that really keep the patient and community at the center of everything, with respect at the basis, and with communication really as a tool. And then the other side that I see of it is the values and behaviors that are also important are ones that recognize that frontline staff have a richness of wisdom and experience that can really be a great source of ideas and solutions. And also recognizing that frontline staff are going to be the conduit for any work or any successes that are to be accomplished. I work with underprivileged communities in the work that I do, and because of that, resources are tight. So we are working with approaches to try to harness digital and technological opportunities to make sure that these communities don't get left behind. Because if we really want to become accountable for care and for population health outcomes, connecting citizens, patients, and organizations digitally has got to be a key part of this approach.
I just want to talk about what a great opportunity the Global Digital Exemplar Programme provides for our organisation to transform healthcare in Liverpool. Liverpool is a city that is very deprived and has very poor health outcomes, and the Global Digital Programme will give us a chance to change all of that. The international partnerships are a key part of the programme. We need to learn from others. We need to learn from those who are ahead of us so that we can implement the best solutions for our local health economy. And we're really delighted to be partnering with Boston on this programme. We know of some of the great improvements already made in Boston, and we know there's a lot to learn, both for our hospital, but also for our city of Liverpool and the wider National Health Service. The digital programme that we are embarking on is a 3-year programme, and it's really important, I think, for us through that programme to change the culture that we have within our health services in this country, to enable people to connect in a different way with the health services, empower our staff, empower our patients, but also ensure that people are in touch with their healthcare in a much more creative and innovative way.